Hi everybody, Dr. Terri DeNeui here, nurse practitioner and founder of EVEXIAS Medical Centers and EVEXIAS Health Solutions. So one of the things that we see every week in our clinics and that we train our providers on is how to manage thyroid at a higher level, different than what we were trained. And I always get patients come in our clinics every week and say, I know I have the symptoms of low thyroid, cold hands, cold feet, I'm tired, I'm depressed, so many more, dry skin, and constipation, all of these symptoms of low thyroid, but I go to my provider and I've been told my thyroid is normal. So I just want to really quickly explain to you why many providers will say your thyroid is normal, because they were trained like I originally was trained, and that is to just look at one thyroid lab, and that is called the TSH. Now, the TSH stands for thyroid stimulating hormone, and it is a hormone released by the brain in response to circulating T4. Now, T4 is a hormone that's made by our thyroid. So this is made by our thyroid. But this is the part that so many people miss, is that T4 has to convert to free T3, and this is the only active thyroid circulating in our body. So if the healthcare provider is only checking a TSH, which is only reflective of T4, they're not going to know what your free T3 is unless it's tested. I can't tell you how many patients come in with a normal thyroid lab, which means this one, and actually have a low or suboptimal free T3, and you get them on a really great product like a desiccated thyroid, which is a combination T4, T3, and they feel amazing. I had a patient I just talked to today after 3 days of taking thyroid, and he was told his thyroid was normal, and he had elevated thyroid antibodies, which is a whole nother conversation. I'll talk about that in another video. But just in 3 days of taking a low dose of desiccated thyroid, and my favorite is Nature Thyroid, that he couldn't believe how much better he felt. He was depressed. Do you know how many patients don't relate and how many providers don't see the correlation or understand there's a correlation between depression and low T3? Did you also know that low free T3 is highly linked to heart attacks and to congestive heart failure? There are so many things that most of us don't understand about thyroid, because we really were simply only trained to check the TSH. So if you are a patient or a healthcare provider that wants to learn more about this vital hormone and to maybe even get your levels checked, give us a call at one of our clinics or visit evexiapel.com and find a provider near you, because they have all been trained in advanced thyroid concepts.